Thank you for staying with us. The health sector is one important division that many depend on for survival. However, there have been lingering issues affecting its optimum performance in Nigeria, leading to several strikes from members of its various unions. President Bola Ahmed Tinubu has, however, promised to set things right by ensuring it meets the standards set by the World Health Organization and United Nations. While making this commitment, President Tinubu also met with the Joint Health Sector Union, where he urged them to call off the existing strike. He promised to resolve all identified problems plaguing the system through adequate investment, infrastructure, and better welfare for workers. Well, joining us in the studio is public health consultant Dr. Tuyi Mebawondu. Good morning.
Good morning. Thank
you for joining us.
Thank you for having me.
Right. It seems this promise been made by the president is something every successive government makes, is a promise they made that they will prioritize the health sector, ensure its optimum performance, but we do not often get that result at the end of the day. Let's begin from what it is that governments oftentimes do not get right when they're talking about addressing issues with the health sector.
First and foremost, it is a bold statement if you look at the manifestos of the party on health. First of all, they link health to national security, they link health to economy and productivity, and made a vow that this time around, I'm going to put money in health to change a lot of things. Wow, all of us are looking up to that. And you look at the strategies that is being thought about, first and foremost, it's okay, primary health care center is going to be the bedrock of the health care delivery in Nigeria. Where is the state of primary health care centers? 30,000 primary health care centers. Barely 6,000 of them, just a mega 6,000 of them can provide the basic health provision. Just 6,000 out of 30,000. So a lot of work needs to be done in that regard. So for most of the past governments, they've not been able to sincerely look at, understand the dynamics of the challenges the health sector is facing. One of the challenges is the fact that there's funding shortfall. 50% was their own recommended, what they thought they can give to health system, but the best we've done is about 5.7%. Now this year, which is just above a trillion, most of them recurrent expenditure. So we're not having money to actually run health system. The second thing we're not having to run the health system is actually the human resources for health. We've been over this here and there, and then we've not been able to sit down and address that critically. And it has to start with the training. You have to encourage people to do science. You have to provide training mechanisms for them and something to keep them within the country. We've not gotten that right. The policy directives are clearly, we have the basic primary health care fund, which we put at 1% of consolidated. But how much can that do? This year, about 450 billion naira. They are even taking away about 10 billion away from it. What would that amount to? And then you look at our health budget. Our health budget will just provide about maximum 8,000 naira per person in this country. What would that do in terms of health? So the primary health care is not working. The human resources capital is not there. The requisite fund is not there. Research is not there. We cannot even respond appropriately to public health threats, public health emergencies. And it won't be surprising that at the end of the day, all the statistics are staring at us. Nigeria, first, we are in Nigeria now. Every blessed day, we are losing 2,300 under 5 every day. And about 140 pregnant women, or women that are pregnant, every day. So, that's a huge compromise. We're number one in malnutrition. We're number 2 in HIV. We're number 1 in so many negative things. Our open defecation we're there, standing there. And of course, the recurrent diseases that can be prevented, they're staring at us in the face. We're not having the requisite response to them. The health sector is fragmented. The local government cannot really do all they need to do because the primary health care centers are there within their purview before. Yeah. But right now, it's been taken over. Everything is the concept of primary health care under one roof is being jettisoned. In a way, yes, that's what we're supposed to work for, but there's no fund to do all these things. And when we look at our funding response, we said National Health Insurance Scheme, which we're now doing less than 5%. Ghana is doing 68%, Rwanda is doing 90%. So we're just at less than 5%. And most of those percentages resides within the formal sectors. The community level, the informal sectors, they're not getting the requisite fund. It's such that our emergency response is so poor. In any accident now, which ambulance are you going to call? Who's going to pick you up? So our health situation is so challenging that even our level now, we're just about 160 out of 195 countries by the what they call the global health security indices. We're just far away from understanding what we need to do about health. If you don't understand health, we cannot understand development, we cannot understand security. And unfortunately, this government says that they're going to connect those things. We'll wait.
Right. And on top of all this, again, is the thorny issue of welfare. And at the end or towards the end of the Buhari government, Johesu embarked on a strike, as well as resident doctors as well. Thankfully, for the sake of a large part of Nigerians, President Tinubu has been able to weather the storm, at least with Johesu now, after meeting with them. But when you look at this issue, it's been a burden many governments over the past have had to deal with, leaving Nigerians and the masses to suffer for it. But what do you make of the back and forth, the fact that the strike was suspended by the joint health workers, as well as all these issues that are before the president?
Well, you see, I don't envy the president, honestly. He said, don't pity me, I asked for this job. But in reality, we should love him, we should empathize with him. It's not pity. Pity and empathy are different things. We should understand the humongous nature of what is confronting him. Here you are. The first move that actually gladdens one side is the fact that Johesu was on strike. He called them and said, guys, come, let's talk. And that is, so people want to be recognized, people want that kind of camaraderie and discussion to continue at the level of government, at the topmost level of government. He has done that, and I'm sure next time it's going to improve. The discussion and interaction is going to improve. Now, the big issue, as far as those unions are concerned, is actually about governance, governance, health governance, clinical governance, and how to create a sync between different units of the healthcare system requires an additional skill, apart from being a doctor, apart from being a nurse, apart from being a lab scientist. You require a management experience to be able to really interact, interwoven and manage these people. That is the huge issue. Then the second thing is that we will always be seeing the issue of parity, remuneration, how is it structured, how is it, all these things that play into everybody trying to show that I am better than you. But of course, health is a collaborative endeavor. You have to collaborate with different workers, different sectors to be able to deliver health. In fact, you have to collaborate with the education system. So I had expected that at this point, the president should have actually declared an emergency in health sector. In fact, I was expecting a presidential order to look at critical things, health, what are we going to do about the education, what are we going to do about it, as security as it is. So I was explaining those things, but, well, it's not too late. We need that kind of conversation on how do we now sit down, okay, and look at the critical aspect of health. I have mentioned one, finance. Of course, the Financial Act that gave 10 naira per liter of carbonated drink to be spent on health. I mean, we should push that. That will bring a lot of money from some other sector and put into health. Of course, the question is that even when you get this, how are you going to spend the money? There is a big issue on the ground, corruption, even in the health sector. Corruption is everywhere. So this little money that is coming, we need to be able to apply it appropriately. Look at what we budget for immunization. I mean, paltry sum, about 700 million, which is nothing. We have to rely on donors. Until the country can free itself from the donor in terms of running itself, it becomes a huge issue. But the low-hanging fruit that we can really attend to is, look, first and foremost, what can we really do here? Let's go and focus on primary health care. Okay? A mandate to each of those primary health care, primary health care center, in the area of operation, ensure that you do the following. 1, 2, 3, 4. Okay? To deal with malaria in every sector, it's a small amount of money. If you look at the budget per person, that is, if you take malaria away, you have solved quite a huge number of the problems, because pregnant women, children, and all those things. And to solve them is not that difficult. To solve that is not that difficult. So after ensuring that private health care are empowered from just 6,000 out of 30,000, because 744 local government, 774 local government, 30,000 private health care center, only 6,000 can provide the basic health services that we're looking at. So bring that money, put them so that those ones can function. For the first year, increase the number that can function from 6,000 to 10,000, to 15,000. Let's be looking at half of them functioning properly. What do you need to make them function? Yes, you will not be able to put doctors in there. You know if you see the doctor. But I can see you can put community health workers in terms of some high-level nurses that have been trained to intervene in these common diseases. Those ones can be there. Then the second thing is that I'm looking for an ambitious program where a government will be able to link every Nigerian, all of us have BVN, link every Nigeria to a healthcare service. Okay? Government must be able to bring in some other people. Government cannot just wake up and say they're doing it alone. I'm expecting President Tinubu to look at faith-based organizations, NGOs, because you see that Catholic, for instance, is doing a lot of work in health. Yeah. Why can you collaborate with them and ensure that at this point, Catholic, come, we're having these health issues. Health belongs to all of us. What can you do? You've been doing this in the past. Seventh-day Adventists, come. You know, some other organizations like that, NGOs, come. What can you do for us in health? Okay? You have to bring all of them. Then what we've seen is that we see a lot of exclusion of the private settings, private hospital and private healthcare services from this health thing. But they're also there. At a locality, listen, we're seeing a lot of hypertension in this place. What can you do to help us reduce? Check the blood pressure. This is the support we can give to you so that we don't see a lot of stroke, a lot of sudden cardiac arrest in our tertiary health center. Well, once you do that at the local level, you have little people remaining. Those people living now, you now raise up the Health Insurance Act to be able to pick them up and link them to critical care when they need critical care, cancer care, surgery, and all those things. Those ones can then be done at the level of those tertiary things. I saw it in the manifesto, the thought of having general hospital in each of the federal government does not need that. You should leave the state to run their general hospital. If you are talking about world-class specialized center, which you hope to build in each of the geopolitical zones, focus on your tertiary institution, strengthen the tertiary institution, bring research to it, put money into it, incentivize training of doctors, give grants, give scholarship to those ones that are not just doctors, health workers. Let them have a feeling that as far as I'm studying health, laboratory scientists, pharmacy, doctors, nurses, and co, that government have a stipend for me, which I am expected to perform after leaving work. So you must be able to create that environment that will help people to want to embrace health. But as it is now, capacity to train 3,000 maximum in Nigeria needs more than 10,000. We will need about how many years? Close to 40 years to get that done. To be able to reach the number of doctors we need. So it's a huge issue, but you have to sort education. If you don't do science, you cannot do health training. You cannot be health expert if you don't do science. You have to sort that out. And then the big elephant in the room is the level of mental health issues and substance abuse going on in Nigeria. It has been said repeatedly, let us declare this thing. Let us prioritize mental health. Let us prioritize substance abuse in this country. Because at the end of the day, it will be a terrible thing for somebody who is addicted to anything to run a family, to run a home, to run a state, to run a country. And that's what we're going to get at the end of the day.
When you say the government should look at prioritizing mental health, give us in specific terms how you want the government to go about it. And some persons will say that the situation in the country is what is making some persons embrace substance abuse as some form of succor.
No, substance abuse is costly because, again, what happens is that there are cheaper ones, but there are also expensive ones. Of course, while talking to the head of media and NDLA a few weeks back, and he said it clearly, because I have asked a question, why are we not mainstreaming tests into the lifestyle of all Nigerians? As we're doing genotype, as we're doing screening for some things, of course, we can also check for drugs. Really? We can check for drugs. The purpose is not to ostracize you It's not to discriminate against you or to even look down on you. But the purpose is to see that how do we get help for you. We need to create more centers where people can phone in centers, where people can then say, I have this challenge. How do I get help? So, and then the conversation, we have to improve it, especially where are the spaces. Of course, the social spaces, the religious spaces. We have to actually increase those conversations and say, listen, mental health is not, it's just one of the things anybody can have. We can get over it. And then we need to recalibrate what is happiness, okay? Because people feel that happiness is about taking substance abuse. But I've done a lot of study on happiness, that happiness will not come from a lot of things people think they're going to get happiness from. So we need to rethink our education, whether at the religious level, whether at home, whether in the school. So the mental health focus on mental health is a focus on things that concern every one of us. Personally, when I look around, when I listen, when I see, I become personally afraid because of what the 20 years may hold if we don't do anything now.
And if we can do a postmortem of the COVID time, I know you spoke extensively. You were a real handy resource person, at the time, and you still are. But it also brought up a lot of opportunities that Nigeria had been lagging behind in terms of telemedicine, and we understand that the government is also looking in that direction. There's also the issue of molecular laboratories to be set up in states, across states, and apparently there doesn't seem to have been, much inroad. We still are yet to tap into the opportunities. Do you also buy into that argument that this is something that the Tinubu administration can also look into?
Yes, indeed, we have to look at, because you see, the integrity, because if you're looking at the health as a scope, how can you protect the health of your citizen? How can you respond to urgent public health emergency, okay, like COVID, biological, or even bacteria? Like COVID came up, it was urgent public health emergency. How can you respond? You have to look from the point of prevention, detection and reporting, treatment, environment, and risk. It's a whole thing you have to look at, and that's what the Global Health Security Index was measuring. And indeed, we're far behind. What we need to do, essentially, because I know that we have about 3 or 4 that molecular lab that can actually level 4 laboratory in the country. One is in Yaba here, one is in Osun State, and then there's one in maybe Abuja or ABU. We need to raise those things up. But raising those things up requires human resources for health. We have to be deliberate. The government has to be deliberate about it. But what we can do right now, what the government needs to do, is to invest massively in what I would call health literacy. Those are like low-hanging fruits. If I understand deeply the risk I might face by doing engaging in some behavior, if I can internalize it, if I can imbibe it, if it has become part and parcel of me, I would likely run away from that risk than experience the negative part of the risk. So, health literacy, our public spaces, billboards, television station, programs. Recently, there was a film that was to be shot on somebody who didn't understand the importance of CPR and gave a kiss, and the guy was killed in a culturally challenging place. He was killed because they say, how can you be pressing this woman's breast in the public? How can you be, kissing her in the public? Because they never understood. So who do you blame? The space, that space is open, and then as the space is open, a lot of misinformation is entering it. We need to replace it with proper information. So government can now say, for instance, Lagos State Health Literacy Project, federal government health literacy project, what are the discussions that should dominate those health literacy? We are seeing even the chronic illnesses rising in Nigeria. A lot of people are dying from complications of diabetes, hypertension, and all sorts. Liver diseases, cancer. We are not communicating. Everything is still shrouded in, oh, may God forbid, it is not my portion. There's a miracle somewhere here. Yes, there's a miracle somewhere there, but again, what we know is actually to have knowledge that can help us take decision. That is another, and I hope that one state in this nation can get it right and be able to sit down and look at health holistically and say, listen, I'm deploying health literacy, I'm deploying some intervention at the local government level. I'm monitoring. People are calling. You know, my ambulance can work. And then the rest of the state will start copying that state, for instance. It's not going to be easy for federal government has a lot of things to do. A lot of things to do. You've seen what the subsidy is. You've seen the housing deficit. You've seen the education. You've seen security. Lots of things. And health is just getting 5.7% of the budget, which is like just above $1 trillion. And most of them are recurrent expenditure. 72% of that are recurrent expenditure. Nothing into actually promoting and enhancing what they call research. And building infrastructure, health infrastructure to respond. So I will get there, but again, first and foremost, everybody must be empowered to take the right decision to protect his or her health.
Right. Let's go back to this matter of data. Earlier you said that everyone has a BVN and you're looking forward to how the government will link people, their BVN and all of those to healthcare, addressing matters of healthcare basically. I would like for you to perhaps expatiate on how you intend to see the government use data judiciously at addressing matter of healthcare in Nigeria.
Now, our data, first and foremost, we look at the big killers, the big problems in our health system. We cannot be proud of maternal death we're having. We cannot be proud of under-5 mortality, 2,300 every day. Maternal death, 140 every day. We can't be proud of that. First of all, we look at those negative things and find a way. And interestingly, what we can use to resolve that are just minor things. But why we're not doing it is still a question mark. Okay? Now, when you look at those data, we put them together and figure out that what intervention do we need to do to reverse this. Now, first of all, you have to actually structure it and look at the figures for this region, for this state, and for that state. You look at all those things. Of course, we're leading in malnutrition. I think I should have mentioned that. Yeah. Yes. So we have to look at those things and say, why should Zamfara be having this number of malnourished people? Is it a food practice? Is it a cultural practice? Who do we need to get involved in those things? Data helps you to think. It helps you to resolve things. It helps you to monitor. Data helps you to see whether you've online with what you are doing. Yes. So once you get that, okay, once you get those things, you decide what intervention you want to do and use data to measure. Now, because a country that has this kind of birth rate, 5 per woman, is quite challenging. It's quite challenging. So you use data to monitor and do what you want to do. Then the second thing is that you aggregate your citizens. These people who live in this area. How many health workers do we have in this area? I don't care whether the person is a nurse or is a pharmacist or whatever. Okay? This person should have any problem. Who should he talk to? Okay? Is there any number that appears on his phone or her phone that whenever you have a problem, you can call health and it gets to a health person that will take up the thing and connect to a higher level, or intervene at that level? That shouldn't be too difficult. But, the number you help can reflect in kind of some stipends for you. It can be a sort of stipend for you because when you help, it's obvious that you help. Clearly, you can't forge those kind of data. So in reality, at a point, everybody knows that I can put a call through, this triaging, this person can pick the call and call another doctor or another hospital to pick up my case. As I am now, I can't readily in my head think of, until I have to really contact friends to think of a neurosurgeon, that can do a borehole and do the compression. Of course, we lost one of our mechanics, who was traveling and was hit by a truck, mismanaged in a place, unconscious for 1 week. After 2 weeks, they now brought already blood all over inside the brain, and of course, died. So even for me, I was wondering that if I need to call a neurosurgeon now without connecting to anybody, can I really get a number? Right. So these are the critical things that will determine how you move your human resources, how you move your finance, how you move your process to solve critical health problems. But there are 2 common things that we can resolve, Look at waterborne diseases. Yes, we need to provide water. We're not getting good water. Guys, this is how to ensure you have good water. Buy water guard, put in your water, take your water this way. These are basic education, which we learned in our villages when we were growing up. But all those things just disappear, and it's replaced by, it is not my portion, God is there for me. Well, we all wait. So that is how to use data. First and foremost, it tells you where you are. It determines the intervention. It helps you to monitor and even actually reevaluate your intervention.
You spoke earlier about the health insurance scheme and how that only a minimal percentage of Nigerians are covered. And some have said perhaps the problem is the non-mandatory nature of the act, and are soliciting that it should be compulsory, that everyone, private, public employers, should be made to pay for the health insurance, so to speak, of their employees. What do you say in this regard?
For me, the first, if I were to be part of the president team, or if my opinion is simply that if you want to enter university or secondary school, you must show your health insurance. If you want to access some things in this nation, you must show your health insurance. We could easily raise a lot of money. In fact, I'm going to actually call the faith-based organization. They have a lot of influence. Churches, mosques, whatever, Guru Maharaji, and whatever. They have a lot of influence. Okay? I want all your members to have health insurance. At least the basic one. Okay? But when the money comes in, that's where the problem. Most of the lackadaisical attitude we're experiencing in this country is because trust, there's a huge trust deficit. When you listen, somebody spent how many billion on fake care, you get angry. Somebody stole this amount of money, you get angry every time. And that's why I said that corruption could be a big issue. Because when people know that the money will be used for what it said it's going to be used for, they will readily drop that money. Okay? Is it not health insurance? So we have to co-opt our churches, our mosques, our whatever, native, everybody into this. We have to co-opt the community. Go right and meet the kings and the ballets and tell them, and the imam, and the sultan and imams. It is mandatory now that you have health insurance. And look at your primary health care centers. Whenever you're sick and they're not attending to you because you've paid, let us know. Okay? Collect the money, link them to a primary health care center where they can get some level of care. It's important. So, and then at some level of entrance into some things, ask for their health insurance. If you are going to collect driver license, why shouldn't you have health insurance? For instance. Right. Okay? So we have to link, through the BVN, we can link everybody to certain health insurance, but we need to manage the money appropriately. If we don't do that,
that's the major issue. All right, we need to
go to court.
We need to quickly go on a break.